According to a ProPublica report, the U.S. has the highest rate of deaths related to pregnancy and childbirth in the developed world. The ProPublica project also found that half of those deaths, women and children, are preventable. The report, called The Lost Mothers, was published in 2017. It was co-written by Nina Martin, who's now a features editor for RevealNews.org, and she joins us now. Nina, thank you for being with us. Thank you for your work here.
Thank you for having me.
An estimated 700 to 900 women in the United States, the world's wealthiest country, died from pregnancy-related causes in 2016, the year before this project was published. So how do you think overturning Roe versus Wade, if that happens, would impact these numbers?
It's really clear that those numbers will go up. We don't know by how much, but they certainly will go up in states that either reduce access to abortion or ban it entirely. One thing that is important to know is that the changes that are happening now around Roe come in the context of a really actually very difficult period for maternal health that happened during the pandemic, that happened during the COVID. The CDC released new numbers earlier this year, just looking at 2020, and what they found was that maternal mortality actually increased in the U.S. by 18% from 2019, and the gap was really widest for African American women. Their death rates rose by I think at least a quarter. Percent. So by 25%.
Well, let's talk about the role that race plays when it comes to surviving pregnancy. You want to have a child in this country, you're at greater risk, as you're pointing out, if you're a black woman and other things. So talk a little bit about that, about those inequities.
Well, let's talk about race, but not as an issue of the problem being that a woman is black. The issue is the experiences that women of color, black and indigenous women in particular, experience during their lives that makes their bodies age faster and be much more susceptible to the kinds of pregnancy complications that can be really serious. And then black women and indigenous women both experience a lack of access to really, to healthcare at really critical points in their lives, including in the postpartum period. So 6 weeks after women give birth, and they, in many states in the South, your insurance is cut off, your Medicaid is cut off after 2 months after you give birth, and that's actually a really dangerous time for maternal health and maternal complications, maternal deaths. And finally, of course, there's racism. I mean, racism, implicit, explicit, institutional, is really endemic in the healthcare system and at every place along the way. And all of that means that black women and indigenous women are much more likely to have this kind of cumulative effect that makes the experience of being pregnant, giving birth, and then trying to raise their child in that postpartum period really dangerous.
And this report, Lost Mothers, got a lot of attention when it came out. Has it led to changes, any actual changes in maternal health policy, and what would still need to be done?
It's led to really huge changes, which has been really gratifying. When we reported our initial findings, hospitals were not taking complication rates very seriously. They didn't have procedures and protocols in place to protect women. A lot of states were not doing a very good job of investigating maternal deaths. They weren't, so that they couldn't understand what was happening in their states and what steps they needed to take to make things better. There was no focus at all on the particular problems that black women were facing, and there's been a lot more focus and research in the last few years about that. But one of the really big things we found in our reporting was that one of the big underlying issues is that the healthcare system over time has come to prioritize the health and safety of babies over that of mothers. And I think that that's another way that what we're seeing play out right now in with the restrictions that are happening around the country around abortion and other reproductive care is that clearly the fetus is what is so much the focus of so many lawmakers around the country. And that means that women are really going to suffer and die.
A lot of work to be done. And Nina Martin, features editor for Reveal, thank you very much for doing some of that work and for bringing it to us. Appreciate it.
Thank you for having me.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.